Hi, I'm Jane Logan, the Executive Director of Genesis Place. We're glad that you came to just see what we do here. We are a supportive housing program for adult males who've been discharged from institutions. 91% of our gentlemen are disabled veterans, and that's because the VA keeps us busy and fills most of the openings, so there's not a lot of room for others. But we do have 3 others that are referrals from Grant Blackford Mental Health Center. All of them get along amazingly well together. I'm really quite proud of them. What we do here is provide housing, which means they have a bed, a dresser, all the linens that are required, and towels and washcloths. Those things are all furnished in the one price that they're charged. We have a TV in every room, unless they demand that it be taken out, and there are a few that do. We have usually a chair and anything that it takes to live comfortably. We have 3 meals a day, 7 days a week, and snacks are available around the clock. The dining room is open all the time except for about a half an hour twice a day while they mop the floor. But we provide help with appointments, with getting to appointments, transportation to appointments, even out-of-town ones. We also provide what I call advocacy work between the agencies and doctors and social workers, because a lot of our gentlemen really don't have a clue as to how to go about getting the help that they need, and so these are services that we do daily. We work on Social Security claims and VA claims, anything that will help to increase their quality of life. And we've been extremely pleased to have IWU nursing students in the community health program. They are here to get acquainted with what goes on in this type of agency and to give us help. And they give us lots of help, and it saves me a lot of time to have them here. So we're very grateful they're here. This time it's been Joel and Sarah. Many before them have set the path. And we're glad that you're here to see what they've done this semester. Thanks.
All right, well, we're here at Genesis Place in the med room. So I'm just going to take you on a little tour of that process. All the meds come in through the mail in these little baggies here. And then what Joel and I have mostly been doing this semester is opening them up and getting them organized. All of them come just like normal bottles, and then they have the refill slips and medication information and things like that. Then we just pull off the refill slip, and then I'll show you in here. This is the whole med cabinet. We put the refill slips in here, and then at the end of the week or month or whenever, Jane goes through and sends in the refill slips to the pharmacy. And this is just an example of once they're out of there, then we just put them in here. Each of these bins has 2 names on them, and most of them are separated by like a filing card. Can you see that? Or something like that. And these are the bins that we organized of the overflow things in case they can't get a doctor's order over the weekend for a medication. They can look in there and try and find it to hold them over, like if it's blood pressure medicine or something that they need right away. There's also in here is first aid supplies and lots and lots and lots of inhalers and insulin syringes. So then after these are all organized in here, each week at the beginning of the week, Jane goes through and looks at the ones that are needed for each day and then organizes them in the pill cases, which we're going to show you in just a second. So this is out in front of the office, and this cabinet is kept locked up. But this is where they keep all of the pill boxes. After Jane gets them in and puts them in the boxes in there, she goes through and looks at the different meds for the day. They're all labeled for morning, noon, evening, and bedtime, and goes through and puts them all in each of these at the beginning of the week. Then in the morning they'll get up and take all the morning pills and dump them into cups like these, and then it says the time that they need to be given and the name and the patient's name on here, or the resident's name, and then they hand those out. And then the same thing goes on for noon, evening, and bedtime. And there's also, some of them have like a PRN box too for their PRNs.
This is the other medicine cabinet. See some of the medications here. This is one of the projects I've been working on this semester. Up here we have a lot of random things. There's Ziploc bags, hemorrhoid cream, all kinds of stuff up in here. Down here we have all the cigarettes. Nice little stash, and interestingly enough, behind that we have the inhalers. It kind of goes well together. And then down here, all kinds of shampoos and deodorants, shaving cream, more cigarettes, and a bunch of random stuff, combs, hauls, an LCD sports watch, lots of stuff down here. And so I've spent the semester organizing some of this, so that's what this cabinet's all about.
Okay, now we're here in the Genesis Place kitchen. This is where all the food is made. All the guys get 3 meals a day. They also have cabinets out here that they keep snacks and things, so if they want something when the kitchen's not open. And they have a refrigerator and a freezer out here as well, where they have, you know, ice cream and drinks and things like that. And then they set up out here the normal food. Yeah, Steven said you'll never go hungry here. This is the freezer room where they keep all the food. They all have numbers on them, and they all have some organization to it. This is the milk freezer for the refrigerator. Sorry. And this happens to be my personal favorite. Dun, 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 dun. And when you're at Genesis Place, you too can help yourself to anything in freezer number 5.